But first, we're going to turn now to another big story, and that is the Canada-U.S. border. Temporary restrictions on travel across the border remain in place until July 21st. And according to a new poll, a strong majority of Canadians think that the border should stay closed for the foreseeable future. But south of the border, a bipartisan group of U.S. representatives is pushing for a phased reopening. This despite a recent disturbing spike in COVID-19 cases across the U.S., about 50,000 new cases in a single day. So what's the rush? And what kind of travel do they want to see permitted? Brian Higgins is the U.S. representative for New York's 26th Congressional District. Congressman Higgins is also the co-chair of the Congressional Northern Border Caucus. He joins me now from Buffalo, New York. Congressman, thank you so much for joining me.
I'm glad to be with you. Thanks.
So you and your colleagues are calling for what you're calling a framework for a phased reopening the border. What would that look like, and how quickly would you like to see it?
It would be a joint effort on the part of the United States and Canada to develop a plan for the gradual opening of the border beyond the essential traveler, seeking to expand the definition of a essential traveler for those that have business in Canada coming from the United States, those who have family, those who have property. And if they practice social distancing, wear face masks, and good personal hygiene, we don't believe that there would be a problem relative to the health and safety of the good folks and our neighbors in Canada.
So you're not talking about a wholesale opening. You're talking about essentially expanding the list of people who are exempt from the restrictions, right? So we have the essential workers, people like truck drivers, healthcare workers, and a bunch of other categories. Can you give us more specifics of exactly who you would add to that list that wouldn't be sort of fundamental to core supply chains or healthcare?
I live in Buffalo. I, like a lot of Western New Yorkers, spent summers over on the Lake Erie shoreline in Canada. A lot of people from our community own cottages in Bay Beach, Crystal Beach, Long Beach, and other areas along the Lake Erie shoreline and the Lake Ontario shoreline in Canada. Those people should be able to go and check on their properties and maintain their properties, take care of them. They're going to be on their properties. I just think that the two governments could develop a criteria that has to be adhered to ensure that the Canadian residents are safe and kept healthy with a protocol of what people would be required to do if permitted in this expanded essential traveler category.
Do you think that's a tough sell right now when you look at the case numbers from your country? And certainly nobody takes any delight in what we're seeing out of the United States. But we've seen public polling here in Canada, 81% say keep it closed. We've seen some prominent doctors say keep it closed at least until the end of the year. It's a hard sell, don't you think, to get Canadians to loosen things?
It is. The Canadian federal response to this pandemic was early, strong, and unified. The United States federal response was late, disorganized, and very adversarial. We have many more cases per 100,000 population in New York State than the entire province of Ontario, which includes Toronto. Toronto is to Canada what New York City is to America. And there are considerably more cases per 100,000 population. And all of us, whether you're an elected official on the U.S. side or the Canadian side, we have an obligation first and foremost to ensure that our people are protected so that they're not subject to this highly contagious infectious disease. Your federal government did a much better job than our federal government. We understand that. And this is going to be driven by data, by fact. And the good thing is New York State has bend the curve. And there's 52% fewer cases on a rolling 7-day average. The problem is other regions of our country, they're spiking to numbers that have not been seen during this entire pandemic.
And that's the challenge, right? Because any exemption at the border can't just be for these specific Americans from these specific states. It kind of has to apply to everywhere. And when you look at Arizona, Texas, California, Florida, I mean, how do you make that work in a way that would satisfy your constituents, for example?
Yeah, it's a tough one. It's a very, very tough one. And, just to give you an example, New York State, for every 100,000 population, there are over 2,000 COVID-19 cases. For the entire province of Ontario, including Toronto, a big international city of almost 3 million people, it's 267 COVID-19 cases for every 100,000 population. We acknowledge we have a long way to go, and a lot of this had to do with getting a late start, not being organized, not having our president marshal the resources of the federal government, as opposed to pitting the governors of the 50 states against each other. They were bidding on personal protective equipment, ventilators, which was driving up the costs. And there was a scarcity of those things. So it's the tale of two countries, and one did a very good job, your country. Ours didn't do a very good job, and now Americans can't travel to Canada, and as you know, they can't travel to most of Europe. Canadians are welcome in the European Union. Americans are not. So we have a lot of work to do to drive those numbers to a safe level to convince the Canadian officials that Americans should be able to travel in Canada.
So in the meantime, Congressman, we're in this situation where we have these month-by-month rollovers of the border closures, and the Northern Border and Caucus, which you're a part of, said this prolongs uncertainty and creates unnecessary tension. Other than these month-by-month extensions of the border closure, what kind of changes do you think could be made to ease some of that tension that you say exists?
Well, the only thing that we can do is drive down our numbers on the U.S. side. And those are the numbers, those are the only numbers that really matter. I mean, you think about this, a highly contagious infectious disease, 135 Americans are dead of COVID-19. There's no treatment for this. There is no vaccine. The best thing that our fragile healthcare system can do is give somebody who's, struggling through COVID-19 Tylenol. To try to help reduce the pain and the fever. That is not a good scenario as it relates to driving down these numbers. And if all these states that are now experiencing these spikes in COVID-19 cases, they were laughing at New York State for being on a lockdown, for being so serious about this. But New York State's numbers have been reduced by half. These numbers are spiking in places like Florida by over 1,000%. So we have a long way to go, and we acknowledge that, but we have to continue to try, and we will continue to try.
Okay, Congressman, good luck. Everybody wants the U.S. to get on the right path here. Thank you so much for your time.
Thank you.
That is Congressman Brian Higgins from Buffalo, New York.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.